looking for clues to detect diabetes early. You may be surprised to learn that your skin can tell you a lot about your condition. In fact, certain changes in your skin may be one of the earliest signs of diabetes. But don't worry, in this video, we're going to reveal the 8 common signs of diabetes on the skin you need to recognize. Number 1. Dry and itchy skin. Did you know that dry and itchy skin can be a telltale sign of diabetes? That's right. High blood sugar levels can wreak havoc on your skin, leaving it parched and begging for moisture. But why does this happen? Well, one reason is that diabetes can damage the small blood vessels and nerves that supply blood and nutrients to the skin. When this happens, it can cause moisture levels in the skin to decrease, leading to dryness and irritation. However, that's not all. Diabetes can also weaken the immune system, making people more prone to pesky skin infections. These infections can cause dryness and itchiness, as well as other symptoms like redness, swelling, and even painful blisters. On top of all that, people with diabetes may also experience poor circulation, which means their skin doesn't get the nutrients and oxygen it needs to stay healthy and supple. This can lead to dryness, flakiness, and even ulcers. Number 2. Dark velvety patches of skin. Diabetes can cause dark velvety patches of skin, a condition known as acanthosis nigricans. Acanthosis nigricans is a skin condition characterized by dark, thick and velvety patches of skin that usually appear on the neck, armpits, groin, and other skin folds. This condition is caused by the excessive production of insulin in the body, which can occur in people with type 2 diabetes or insulin resistance. Insulin resistance occurs when the body's cells become resistant to insulin, the hormone that regulates blood sugar levels. When this happens, the body produces more insulin to compensate, which can lead to a buildup of insulin in the bloodstream. This excess insulin can stimulate the growth of skin cells, leading to the development of acanthosis nigricans. Other factors that can contribute to the development of acanthosis nigricans include obesity, hormonal imbalances, certain medications, and some medical conditions. If you notice dark velvety patches of skin on your body, it's important to see a healthcare professional to determine the underlying cause and receive appropriate treatment. Number 3. Skin tags. Skin tags are small benign growths that can appear on various parts of the body, and their exact cause is not entirely known. However, high blood sugar levels and insulin resistance, which are commonly found in people with diabetes, are thought to play a role in their development. Consistently high blood sugar levels can damage the blood vessels and nerves in the skin, which may disrupt the normal growth and healing processes of the skin, resulting in the formation of skin tags. Insulin resistance can also contribute to skin tag formation by increasing the levels of insulin in the blood, which can stimulate the growth of skin cells. Furthermore, some hormones, such as growth hormone and estrogen, may promote the growth of skin cells and lead to the formation of skin tags in people with diabetes. Number 4. Diabetic dermopathy. Diabetic dermopathy, also known as shin spots, is a skin condition that is commonly associated with diabetes. It is characterized by light brown, scaly patches that typically appear on the shins, although they can also occur on the thighs, feet, and arms. In people with diabetes, chronically high blood sugar levels can cause damage to the walls of the small blood vessels throughout the body, including those that supply the skin. This damage can result in a reduced blood flow to the skin and the formation of small areas of skin that lack adequate blood supply. Over time, these areas can develop into the characteristic light brown, scaly patches of diabetic dermopathy. Moreover, the damage to the nerves that supply the skin can cause a reduction in the sensitivity of the affected skin areas. It is important to note that diabetic dermopathy is not always present in people with diabetes. and its development is likely influenced by a range of factors, including the severity and duration of diabetes, other coexisting medical conditions, and genetic factors. Number 5. Nail changes. Diabetes can cause several types of nail changes, including thickened nails, discolored nails, and fungal infections of the nails. The high blood sugar levels associated with diabetes can weaken the immune system and impair the body's ability to fight off fungal infections, leading to an increased risk of developing fungal infections of the nails, onychomycosis. Diabetes can also cause thickened nails, which may be due to reduced blood flow to the nails or nerve damage, neuropathy, that affects the muscles and tissues around the nails. Additionally, people with diabetes may develop discolored nails, which can range from yellowing to brown or even black. These changes in the nails can be a clue to the diagnosis of diabetes and should prompt a visit to a healthcare provider for further evaluation and management. Number 6. Skin infections. While skin infections are not necessarily a direct sign of diabetes, people with diabetes may be more prone to these types of infections due to several factors related to the disease. One factor is that high blood sugar levels associated with diabetes can weaken the immune system, making it harder for the body to fight off infections. In addition, diabetes can cause nerve damage that can affect the skin, leading to reduced sensation and an increased risk of skin injuries that can result in infection. Certain types of skin infections, such as fungal, bacterial, and yeast infections, may also be more common in people with diabetes. These infections can occur in various parts of the body but are often found in areas that are moist and warm, such as skin folds and between toes. It is important for you to be vigilant about skin infections and to seek medical attention promptly if you notice any signs of infection. Number 7. Blistering. Blistering can be a sign of diabetes-related complications. In some cases, people with diabetes may develop a condition called diabetic bully, which are large fluid-filled blisters that can appear on the feet and legs. These blisters typically occur in people with long-standing diabetes and are thought to be caused by nerve damage, neuropathy, and poor circulation in the affected areas. However, it is important to note that not all blisters in people with diabetes are related to diabetic bully. Blisters can also be caused by other factors, such as friction or injury, and may be more common in people with diabetes due to reduced sensation in the affected areas. Proper management of blood sugar levels and regular foot exams can help prevent or manage diabetic bully and other diabetes-related skin complications. Number 8. Slow-healing wounds. Diabetics may experience slow-healing wounds due to several factors related to the disease. One of the primary factors is high blood sugar levels, which can damage blood vessels and reduce blood flow to the affected areas. Poor blood flow can make it more difficult for the body to deliver nutrients and oxygen to the wound, which is essential for the healing process. In addition, people with diabetes may experience nerve damage that affects sensation in the affected areas. This can make it more difficult to detect small cuts or injuries that can develop into larger wounds over time. In some cases, people with neuropathy may not even be aware that they have an injury until it becomes infected. Diabetes can also weaken the immune system, making it more difficult for the body to fight off infections that can further delay the healing process. High blood sugar levels can also provide a favorable environment for bacteria to grow, which can increase the risk of infection. Finally, people with diabetes may also be more prone to other health conditions that can affect wound healing, such as peripheral arterial disease, PAD, and venous insufficiency. Both of these conditions can impair blood flow to the affected areas, making it more difficult for the body to heal the wound. To improve the healing of wounds, People with diabetes should work closely with their healthcare provider to manage their blood sugar levels and other health conditions that can affect wound healing. Proper wound care and regular monitoring can also help prevent infections and promote healing. When you observe any of these signs on your skin, it's essential to take action and proactively lower your blood sugar levels. Let us know if you have any questions or insights you wish to share with the community by leaving a comment below. If you found this video helpful and want more informative videos on diabetes, make sure to subscribe and send us a super thanks by clicking this button below. We appreciate every single one of them. And make sure to watch this video right here. It will greatly help too.